Obama administration's effort to fix a broken American healthcare system was noble and laudable. However, because of the political reality in the United States at that time, what it turned into was a political quagmire that was unable to really functionally help very many Americans. It's pretty much doomed to fail in the future, and prioritizing tertiary education would both have salvaged the American political climate and helped far more people for a far longer amount of time. Very proud to propose. Before I introduce a couple arguments in this speech, I'd just like to clarify what our general stance is. We believe that the Affordable Care Act, though noble in its intention, was a failure of a policy that didn't do very much good for very many Americans and certainly won't in the future, and absolutely would have preferred that the Obama administration focused on improving the affordability of tertiary education. Both because we think that that is an incredibly important goal for the United States to have, and because it would have been much more politically tenable both in the short and long term. With that, let's introduce our first argument that the ACA was an incredibly badly written bill that didn't do very much good for very many people. Before we explain how exactly this manifested, let's just talk about the political climate that existed when the ACA was being drafted. The ACA was met with intense, ferocious backlash from many Republicans. And in order to get this bill passed, all of that, the Obama administration and the Democrats had to make a ton of different concessions that essentially undermined the entire effectiveness of the piece of legislation. And the problem with a healthcare policy that combines both public and private elements was that these numbers of concessions undermine basically the efficacy of the entire bill. What did some of these concessions look like, and how do they undermine the efficacy for many Americans? The first thing is that they increased premiums by including pre-existing conditions, by mandating that insurance companies cover pre-existing conditions and expanding coverage to all. Insurance companies now had the justification and the excuse, essentially, to raise premiums to an untenable level. That even though the Obama administration provided some economic relief for the cost of these programs, ended up not really driving down the cost of healthcare nearly to the degree that the Obama administration intended it to. Single state markets for healthcare also decreased competition and drove up prices in that regard, and thus premiums and healthcare costs didn't decrease nearly to the degree the Obama administration wanted to. The second thing that happened was because of a bunch of different concessions that the Obama administration made. Red states, where politics overwhelmingly opposed the creation of the ACA, essentially poked holes in various regulations that the Obama administration set forth, allowed private insurance companies to circumvent a lot of the regulations that the ACA let out, with the support of local and state governments. And note that red states were overwhelmingly those where Americans had the least coverage to begin with. And the fact that these circumventions happened overwhelmingly in those instances meant that the people who needed healthcare most were able to access it the least under the ACA. But the final thing is that the ACA, because of its insurance mandate that required Americans to essentially purchase their own healthcare coverage, meant that Americans who were desperate just to fulfill this requirement often bought not very comprehensive, expensive short-term plans just to briefly satisfy this requirement that didn't do them very much good in the long term, was economically draining, and really didn't provide them pretty much coverage. So even while it was in effect, the ACA was not a particularly effective policy and didn't help Americans very appreciably. But note that even if you grant side opposition that the ACA did have some marginal benefits, the political fact of the matter is that under the Trump administration, the policy is basically doomed. And even if a government that is friendly to affordable healthcare policy is able to replace the Trump administration in 2 to 6 years, the fact of the matter is it took the ACA so long to be developed, it took so much political capital, and opposition to the bill is now so high that it would be basically impossible to reconstruct. So even if the ACA was remotely effective, the policy is pretty much doomed in the long term. Before I move on to our second point, go ahead.
Trump has vowed to repeal and replace, but Republicans haven't even been able to begin to draft an alternative, and the next elections are in November. How likely is it that it will actually be replaced?
Yeah, so actually That's exactly the point. We don't think it will be replaced, and if it is, it's not going to be replaced very effectively. What it is the problem though, is that Republicans, because they campaigned so aggressively on the repeal of Obamacare, repealing that policy to them is more important than actually replacing it. And leaving it in place would be like just completely politically disastrous for them. They're going to basically jettison this policy that's functionally inevitable. Moving on to our second argument, that the political will to uphold tertiary education is a much more beneficial and sustainable thing for the Obama administration to pursue. A couple of reasons this is true. First, the fact of the matter is it does benefit some more politically powerful demographics. The problem of the affordability of tertiary education falls the heaviest on low-income Americans for whom the sticker price of essentially even applying to college is so high that many don't even bother to do it. So we absolutely believe that pursuing this policy is beneficial for them as well. But many middle and upper middle class families are also put off by the high price of education. These individuals come both from liberal and from conservative backings and have far more political capital to advocate for this sort of policy over healthcare. So the policy of tertiary education just generally has far more political will from more powerful individuals to actually be able to, one, be passed effectively, and two, be sustainable in the long term. But second, just like making affordable education more affordable is just far more clear-cut and less controversial than reforming a healthcare system with a whole lot of moving parts, especially in a public and private world. It usually literally just involves funding affordable education. And even if you're not able to do that to the degree that you want to, it's really hard to point to that as an abject failure, meaning that when the Obama administration stakes their entire political advocacy on that, and then the Clinton campaign then has to go up and defend what turned out to be a mess of a policy, that's just way less likely to happen in a world where we're just making tertiary education more affordable. So we jettison the future of politics way less, particularly for the Democratic Party. But also, healthcare is just fundamentally more complex. One thing that conservatives seriously objected to with the Affordable Care Act was this healthcare mandate that they viewed as taking away liberties for people to choose their own health insurance plans. The same sorts of complex, really politically contentious questions just don't arise when we're funding tertiary education. The policy is more beneficial, more politically tenable, helps more Americans in the long term. So we propose.
Thank you, Prime Minister, and I invite you to opposition.
Madam Chair, I want to be explicit here. The rhetorical flourish of opening government does not change the truth. That is, today, more Americans have access to health care than ever before. It's Americans in states like West Virginia that benefit from Medicaid expansion, the very red state that OG talks about. Today, premiums for those who are least well off are lower than they ever were before, and it's because of Obamacare. We're going to give you substantive reasons as to why this actually helps people and engage in the mechanistic quibbles that opening government had as to why the implementation of Obamacare was so difficult. Two things I want to chat about, the political benefits and the comparative benefits. Very quickly, let's talk about what opening government gave you. The first thing we talked about was the notion that the political climate makes it far worse to implement a form of Obamacare. We'll give you arguments about why you get worse education on their side, that is, why you don't actually get the same political benefits that they want, but very quickly, dealing with the implementation here, first they tell you that premiums are rising, we say they've stabilized, we say government negotiations with healthcare providers like Aetna and Blue Cross actually address this kinds of stuff, plus we say that competition still happens, like even when you have single state markets, you still have numbers of insurance providers that drive down premiums overall. Here is the comparative that I think is actually very key. They give you that the reason that premiums are rising is because people with pre-existing conditions are now covered. Note that the reason that Obamacare is so important is directly because of this. That is, in the alternative world, you have people who have pre-existing conditions, the ones that need healthcare the most, that can never afford healthcare because insurance markets discriminate based on their pre-existing conditions. I think the comparative is this. Let's say healthcare is marginally more affordable for everyone in the opposition world. The comparative is that the people who need it the most do not actually have affordable healthcare because the rates get jacked up from them, I think that is much worse. On education, they tell you the sticker price is low, or the sticker price lowers in their world. They tell you the political capital is high. Three things here. First, we're going to say you don't need tertiary education. That will come in substantive. Second, we're going to say the fact that you have simple funding makes it easier to reverse. And the last thing is we're going to tell you why people really don't like it. Great. First thing I want to talk about is why the political protections are better on our side of the house than theirs. That is, even if you presume that you get the majority of benefits from opening government's case, the benefits that they actually didn't spend a lot of time talking about, like they only got to education at 5 minutes and 40 seconds and never actually told you what was meaningful about it, we're going to tell you why, even if you get all of those benefits, it is more likely to be repealed than in a world where you get healthcare. Why is higher education more politically unpalatable? First, I think there is a notion that the vast majority of people do not want to access higher education. That is, there is a massive oversupply of higher education degrees in the market right now, and the majority of jobs that people actually care about do not require tertiary education. But second, I think conservatives just hate higher education in a way that they don't hate reforming the healthcare markets. Why is this? Because I think there's a notion that higher education is fundamentally liberally biased. That is, the faculty of education is overwhelmingly liberal. They donate to liberal causes. The classes, the things that people teach, like universities teach things like women and gender studies that conservatives just hate because they don't like these sorts of things. And we think the whole notion that you get these campus culture, right? Like trigger warnings and safe spaces originate on campuses. Like the whole point of that is conservatives just think that higher education is brainwashing all of the kids. Why is this really important? Because it means even if they get every single benefit that they want in higher education, their own arguments apply. The Trump administration repeals this policy, they revoke all the funding, and guess what? It's not a simple fix. Like, I think the comparative is this. You have to work to repeal Obamacare because there's so much of it. On their side of the house, you can just be like, nope, $3 billion to every single state is absolutely gone. Why is higher healthcare much less politically unpalatable? I think this is very simple, right? Like, people need healthcare. Like, they need access to some sort of care. It's why coal miners in West Virginia are like, oh no, our benefits are being taken away, and they're complaining to their governor. It's why, like, Brian Sandoval in Nevada, like the governor of Nevada, is like, I don't actually want to repeal the Medicaid expansion because it's been good for my people, even though he is a Republican. I think this is vital. Republican governors expanded Medicaid. John Kasich in Ohio expanded Medicaid, and that brought healthcare to his people. Republican senators haven't been able to repeal Medicare, right? Like, this is why you have Lisa Murkowski and Susan Collins saying, we don't want to actually repeal Obamacare, we don't want to actually do all these things. It is because it is far more politically protective. But here's the comparative. Even if you believe that either of these things are likely to be repealed in a Trump government, why is the simple implementation of Obamacare far better on our side of the house? That is, even if you take away all the funding. I think this is the crucial argument that infrastructure and the development of an infrastructure network under Obamacare was actually what makes it so important. That is, consider what healthcare looked like in the absence of Obamacare. You had decentralized hospital systems. Like, hospitals didn't communicate. They never shared medical records. Like, none of these things ever existed until Obamacare actually went in and funded the development of all these sorts of systems. Why is this important? Because it means even if you get the best case scenario for opening government, that is, healthcare suddenly gets repealed, the very infrastructure that makes it easier for hospitals to share patient data, the very infrastructure that makes it easier for people to cooperate to make sure every single patient gets an accurate and fair diagnosis, that's the sort of stuff that always stays on our side of the house. I'll take closing.
Most of your pages appears to be an assertion of facts of dubious veracity. But even if they were true, it's the way that these hospitals are communicating more just by merging, which further reduces competition and drives up prices. So, two things. One, I think CG is probably going to give you facts of dubious veracity. Two, like, this is Obamacare. I think they're going to give you reasons about these sorts of things. Two, I think my facts are true. Like, I hope they're true. I looked them up. I've done research on these sorts of things. But three, I think there are substantive mechanisms that we give you. That is, here's what Obamacare looks like. It is not only like an individual mandate, it is not only Medicaid expansion, but it's very direct funding of all these sorts of things. Like, there's a vast number of things in the Obamacare legislation. I think we can give you reasons why, even if it's not like the highest top level stuff, like, these things are still probably true. All the mechanisms that we said are actually fair. Here's why this is important. Even if they get everything, it doesn't mean anything because it's always likely to get repealed. I want to talk about comparative methods too. First, everyone needs healthcare. That is, regardless of your place in life, you are always at risk for something like a disease. You are always at risk for something like needing a surgery. The comparative is that tertiary education isn't needed for the majority of jobs. Second, I think healthcare is the most important thing for the most marginalized people. That is, the most marginalized individuals are unlikely to actually have the capital to afford, like, doctor's visits, to afford surgery. I think you radically change that on our side of the house.
Why is this? Because premiums don't rise for low-income people because now they're covered when every single state decides to expand Medicaid. I think that's actually a very, very good thing because it means that low-income people don't actually pay higher premiums, they just get covered by more Medicaid. I think that is radically good. The specific instantiation of Obamacare is just massively better. I think this is why you see higher rates of sign-ups for insurance among minorities. I think this is why you see greater coverage. I think that other things that are probably fairly important to note is that in a world where there is a massive oversupply of tertiary education and get from government policy, you have still a lot of jobs that don't require tertiary education and a lot of people that have tertiary education now that basically went through all this time of tertiary education instead of working to get good jobs, but they don't actually get good jobs. And I think it's always the least well off who are outcompeted under those sorts of rules. I think the benefits of this are clear. If you work more, if you get health insurance, you are better off. You're better off. You do so many things. I think people being alive is good. Very proud to oppose.
I thank leader of opposition and now welcome Deputy Prime Minister.
Let me be clear. We're not talking about not pushing for reform in any circumstance whatsoever to healthcare. We're not talking about deprioritising healthcare utterly and completely. You, as the Obama administration, can still push for reforms in the existing healthcare system. You can still push for caveats on competition. You can still push for subsidies. What happened to the Obama administration is they staked the entirety of their political capital, the entirety of their platform, on the perfect fulfillment of a healthcare bill which was doomed to have holes, which was doomed to be gaping, and in that circumstance, not only disenfranchised the Conservatives who already hated that policy, but also many progressives who did not receive the healthcare benefits they expected from that act in the first place, and in that circumstance, isolated those people from their act. That politically was a dastardly decision which subverted their future power and made the Hillary administration have to defend that policy under the status quo. 2 points in this speech. 1, politically, is this tenable? 2, let's talk about public goods, particularly on this more nuanced comparative where you can still push for some reform within the healthcare system. You don't just have to push through an entire act. 1, on implementations. Aditya gives you the flippant material, the competition still exists, therefore you're likely to have some form of diminishing premiums. The fact of the matter is, and the material that Ella gives you, that in the states where it's most required to have this healthcare coverage, that is, red states who are more likely to try to push against this policy fervently, who are more likely to not, for example, sue massive insurance companies within these states, who are literally abusing their power and forming and colluding and forming cooperatives within those states, those are the ones who are facing the rising premiums. Those are the ones who have the highest healthcare concerns. Realize the other material we told you, that the necessity to prescribe to an insurance claim in the first place has forced people to literally take the short-term 2 to 3 month insurances, which has meant they're not covered in a substantial way. So true, they do have coverage under their side, and they might have some good coverage, but for the majority of bad, really bad healthcare issues, and the majority of really bad diseases and illnesses, you still leave these exact same people fiercely out of pocket in the same regions where they're already the most disenfranchised. Which means on the comparative, you don't really extract the benefit in the ways they wanted to tell you. The comparative for us is you push through a tertiary education system which has more universal goodwill. That is to say, that people want access to education. And again, they glibly tell you that Conservatives don't want access to education. The current context is exactly what necessitates Conservatives wanting access to their education, for a few reasons. 1, There's other unskilled jobs and jobs which they otherwise had access to in the past are stripped from them. It is their only alternative now, plausibly, to seek tertiary education to replenish those jobs in areas which are otherwise conservative and relied on those manual skilled labour. So if anything else, at least we can prove to you the Conservatives have will at this point in time and at the time of the Obama administration to push for jobs which were more skilled and to push for education which allowed them to access more skilled jobs. That was the primary incentive of the Conservative movement, and that is exactly what allowed Trump to come to power in the first place. So we can bring you that benefit, and that benefit holds in and of itself. They tell you the Conservatives don't like liberal campuses. Rich Conservatives still like places like Ivy Leagues. Rich Conservatives still like other schools like USHIC, which allow them to prioritise their economic interests. I don't know much about the American education system, but I do know that there exist other campuses outside of this myopic liberal dichotomy that they give you. Engage with the nuance that you are literally funding conservative state schools as well. I'm sure that there exist conservative universities. You probably also just want skills, right? Like in a lot of circumstances, you just need a university degree to access a good job. So irrespective of whether or not you are liberally biased and you think those campuses are liberally biased, you probably just concede the reality that you're going to need access to that diploma and to that degree in the first place to access the positions of power that they want to be able to entrench themselves. So I don't know what that analysis was from Ditya there. On Medicare, they tell us it's unlikely to be reverted. But we give you analysis as to why you're more likely to try to poke holes as a Trump administration. Exactly what they're doing now. They're allowing states to escape incrimination for averting that policy in the first place. Because as the Trump administration, you literally have an incentive to be able to point to the Affordable Care Act and say, that was a failure on behalf of the Obama administration. That is exactly what you can peg your entire campaign on under the status quo, and that is what has worked for the Trump administration in many of their conservative voter bases. Yes, it did.
Betsy DeVos's approach to higher education has been to cut it every single step of the way. If you get the increase in funding that you want, why is that not repealed under Trump's administration?
Betsy DeVos has met widespread enmity. The reason that you don't have the same hand, the reason you don't have the same defense is that when the Obama administration explicitly pushes for education reform, that becomes the battlegrounds that Democrats and Republicans fight on in the first place, which means you have more explicit pushback to what Betsy DeVos is doing, but also that becomes the plane upon which Democrats fight, so they're more likely to try to expose the benefits of that education in the first place to conservatives. That's why you're more likely to have the sorts of discourse which is going to lead to positive opinions about that tertiary education in the first place. That's a benefit we exclusively can give you. Secondly, Aditya says that everyone needs healthcare. We agree, that means it's going to be a political exigence under both sides. That is to say that if there is not a sufficient healthcare coverage, that is still going to be protested by both sides, and both governments are still going to have to act in some way to correct that. That is, both conservatives from poor areas who need access to healthcare, but also liberals from poor areas who need access to that same healthcare, are still going to push for some reform. The difference is you don't do it with a broad scoping, extremely badly written apparata, which is more susceptible to scrutiny. The sorts of changes you have are incremental. That is to say, first of all, the Obama administration goes, we're going to put a cap on the sorts of prices that you can pay as an insurance company in a private system. You make another step that is incremental rather than literally trying to introduce a bill which doesn't have political will. People need tertiary education. It's particularly a political exigence under the status quo where you're losing your jobs in general and in unskilled labour. This is why it is necessary for the Obama administration to have pushed this, particularly where there was minority groundswell support for education reform, particularly where migrant communities particularly want access to that education to be able to allow them to ascend within that society. At the end of this debate, we tell you that it's not mutually exclusive completely to have some reform to the healthcare system in some way. That political will is more likely to exist under our side when you don't try to introduce such a polarising bill, and also when you push your platform on education. That's why we're so proud to propose.
I thank Deputy Prime Minister and I welcome Deputy Leader of Opposition.
funny thing about debate. It's a comparative question. So when they say that this was implemented really badly under the Obama administration, they have to deal with the ways that it would be implemented if it was education that was implemented instead, and the way it would likely be implemented. We told you that given the context surrounding education and the likely political support for it in the comparative world, it'd probably be implemented a lot badly given the incentives politicians have. Note this is not just based on facts, that these are mechanisms and incentives for why politicians should care more about healthcare than they comparatively care about education. The second thing to say in this overview of clarification is note their stuff about mutual exclusivity makes no sense. We told you in the status quo there was this massive, before Obamacare, there was this massive problem where the most vulnerable groups were just not getting coverage. And we also told you, and so did OG, that there needed to be this huge change in legislation for them to be able to have access, i.e. actually nationalizing it and creating the infrastructure that was literally not there to be able to build upon this. Now, they say you can also have other types of healthcare provision, but we tell you those would never have gone far enough, and they did require all of that political capital to do. You can't say that you can get all these sweeping changes that but like only the amount needed, and also get education. You have to pick one, and that's why we need all of this for healthcare. So, 3 things in this speech. First, this is a question of what they should do. We tell you the most important thing to prioritize healthcare, tertiary education, is really like a tertiary concern. Secondarily, we're going to tell you about the economic implications of this, and finally, about what the educational system would look like. So, first on this idea of what we should do. Note that there's been like no contextualization in this round as to what healthcare looks like. At the end of the day, if you're someone who's not insured, what does this mean for you? It means that when you're sick, you can't go to the doctor because you're scared that you won't be able to pay for those payments that are necessary. When you need preventative health care, or you're going to get cancer, or you're at higher risk for things like obesity, you don't get the preventative health care you need. This means, one, massive costs to institutional systems of the state anyway when people go to the emergency room, which conservatives hate, and also Democrats hate. This is a bipartisan issue, and it also means people literally die. This is the highest voter rights concern in the round. You can't be educated if you're dead. If you have cancer, you're going to be missing class getting chemotherapy. This is a much higher order question. It's something a government has an obligation to provide for. Also note that in the most vulnerable communities where people don't have access to healthcare, it's usually because of things like government negligence, like governments allowing people to build industrial plants that spread waste and lead to the spread of disease in areas where the poorest people who can't get access to healthcare can't get better. That means the government has an obligation to be fixing that, and it is just and right for the Obama administration to have been doing so. Compare that to the relative benefits of tertiary education. Any benefit they say about why skills training is good, they don't explain why you can't get that in secondary education or in high school, the sorts of things that the government is already funding. The only unique benefits that you can get are from healthcare, from having this insurance. That means you're decreasing risk in the pools of people who are insured, and you're actually making sure people can go to the doctor and get treated. Okay, now on the economics of this. Why is this hugely economically beneficial? It's really important to understand the structure of how insurance works. Note that for Obamacare, right? So the way it works is that you have to be part of this national insurance system, or you pay a fine, or you can get insurance for your employer. What were the types of people that weren't insured? First are the most vulnerable people that were employed, people that were really likely to get sick. But also, it was a ton of young people who were like, I'm doing fine, I'm not going to get sick, and I don't need to be insured. That means 2 things. Firstly, when they joined the population for people getting health care, they actually, even though there was a small spike in the short term in premiums, they actually decreased in the long term because the people joining these pools are at less risk for getting sick. So when an insurer is literally evaluating how much these things should cost, they think, okay, how much risk am I at given the people in my insurance pool? If there's more healthy young people in your insurance pool, the premiums decrease in the long run because insurers don't need to make as much, take in as much in premiums because they don't expect to pay as much out because they don't expect these young people joining the pool to be getting as sick. What it does mean is that people with pre-existing conditions now can get that money in the cases that they face extreme risk. Also note that in terms of individual risk calculuses that they make, when you are fine, you're fine, but if you get sick, it's a huge amount of money that you have to pay in these healthcare systems, and if you don't have access to this, it's going to be really difficult for you. Also note that all of the benefits of competition still exist, right, because insurers are still competing for employers to have them use them as their insurance, which means you get prices decreasing in the long term. It probably also means that you get increased innovation and development in terms of research, because now there's more people that are being insured that are actually seeking treatment, which means, one, we are tangibly able to cure diseases faster. We're able to find cures in a quicker way. We're actually able to test those cures on people, and we're actually able to give people access to the medicines they need to stay alive. Note that the ultimate driver of productivity, right, is people's ability to do work. If they're not able to do work because they're getting sick, or there's systemic populations that are underrepresented in the workforce, that is a prerequisite to any type of economic advancement that they would see. Now, let's talk about the economics of tertiary education. Here's the reality. When the government tries to do small-scale programs like this, like we're thinking about Bernie saying that everyone should have free access to college, or having Pell Grants, or that sort of thing, or governments giving loans to people, what happens to college educations? Firstly, the prices of colleges go way up. So they start increasing tuitions because they know that the tuition will be literally paid for by the government. That means one, the government is paying way more than they would have before, and conservatives hate lots of spending. It's probably more likely to be slashed. But secondarily, it's a really inefficient use of funds because that is not a high priority for the government. I already explained to you why healthcare is more important. But secondarily, in terms of the way this money is used, and I'll take you in a second, it's also likely to be distortionary because these colleges that are competing with one another don't have a universalized system for actually valuing different types of education. Versus for healthcare, you know how much each treatment should be afforded to people, so you can optimize it in a more economically beneficial way. Sure, I'll take this.
Saying that community colleges are just going to jack up tuition if the government pays for the tuition is an easy solution to it, which is what we do for secondary school vouchers. You pay them a fixed amount per student, say $20,000.
Right, but okay, the problem is that the schools now have the power to change the prices because they know you're paying for them. So two things happen. Either A, you start paying way more money, which makes you more vulnerable to have that funding slashed, or B, you stop paying. And note that it's way easier to stop paying for this sort of thing or have a conservative government repeal as opposed to a healthcare system where repealing stuff is really complex. But also, this comparative is crucial. They tell you that there's already infrastructure to build upon to give schools money. Like tertiary school education is already an infrastructure that exists. The critical infrastructure that the Obama administration created was the ability to have this nationalized insurance system, like the sharing of medical records, the understanding of how this stuff should be priced accurately, which means even if it failed, even if it later became totally repealed, even though it's still not totally repealed, that's still good in and of itself because it makes it way easier to build upon in the future, and it also means that like, people who are studying this work are able to do so in an accurate manner. Alright, let's just do some framing. First, in terms of what's likely to be most politically palatable, the comparative on higher education, literally Trump was voted on the back of political correctness. All the stuff that's spread in institutions, they are associated with things like trigger warnings, with liberal space bases. Literally, like the percentage of people for the Ivy League right now is like 40%, and it used to be way higher because people see higher education as a threat. They don't see it as something that is politically palatable. Everyone needs healthcare. Coal miners need healthcare. They're often the most at-risk populations, and it's literally the most politically palatable thing to give you the incentives for why that's true. Secondarily, we told you why this is the just thing for the government to do, and you have to engage with us on that principle. And finally, we told you how comparatively this gives more economic and social benefits. Very, very positive points.
I thank opening class, now to start off closing class, I invite Mendel here.
Way in which opening opposition was fundamentally divorced from the reality of Obamacare is that when they talk about things like infrastructure being built up, what they're really trying to tell you is that the implementation of Obamacare to have been effective required substantial amounts of infrastructure to function, but that infrastructure wasn't pre-existing. So there's something interesting that Aditya says in his speech when he says that hospitals became more centralized and they started communicating information. That's a very interesting political way of saying that they had to consolidate under the pressure of massive costs that now existed when huge numbers of people flooded into a system where we're now required by the individual mandate that was in Obamacare to purchase these kinds of health care. Furthermore, the thing that they don't seem to understand is that repealing these sorts of things is as easy as the Republicans made it. You defund the program and it no longer functions. They ignored the fundamental political reality. Now, our opening told you that this was bad and somehow Trump got elected on the back of this. We're going to give you the substantive reason for why this is the case. Here's why. Even if you grant them that their policy was net better than the education policy that we talked about, it's still far more repealable for one critical reason, that there is a distributional asymmetry of the benefits and costs of that system. So even if the very worst off in a very short-term period became better off as a result of this and their premium went down, so long as the demographics that were amenable to Trump saw their premium rise at all and they expected them not to rise, they were going to vote to repeal this. Whereas that is not true of education, because on the comparative, nobody suffers from more people going into education. The only possible way they could suffer is if there was overcrowding in schools. But given the straightforward means of increasing educational infrastructure, this is unlikely. Because think about it. If you have too many students, you hire an additional teacher, and then you have a new school building. Those are relatively simple to build and don't require complex logistics. But the hospital system, in contrast, that they illustrate is massively complicated because people are constantly making a decision about which hospital to go to. With education, you make one choice. Do I go and get that degree or not? And schools have predictability about how much they will need to accommodate you for. It's very simple for them to do these sorts of things. Whereas in contrast, with healthcare, it's massively complicated because it's never clear at which point you were utilizing which part of the healthcare system. That means that so long as some substantial portion of people saw their welfare decline a little bit, so long as it decreases relative to their expectations, they were going to vote against this and they were going to repeal it. Really simple, you defund it in that case. So it's not at all clear that this was some kind of insulated piece of legislation along the lines that they wanted to tell you it actually was. The second thing that I want to talk about, and I'm going to do a little bit of rebuttal of things they said. Number one, they say that healthcare is a higher order issue because you need to be alive to go to school or something like that that's very glib. But you know what else is a higher order issue? Education. Because when you get education, you're more likely to get a job. You actually get insurance in this country, right? The way that you get insurance under this current system is if you have a decent paying job, your insurer is required to give you healthcare. So it's not at all clear that they are the ones who completely control the link into education in this instance. But second of all, I'm going to talk to you about why we get far better jobs on our side. They say this gives people skills. Here is the real structural way in which this changes the economy. Think about inequality in the United States. Now, it is not just stratified along class lines, but geographically. That when you have cities like New York and San Francisco producing 40% of the productivity in this country, that means that companies want to relocate to these big places because they think that's where they can find educated people, and they think that there's some agglomerative effect that is positive when there's so many educated people in one area. And if you become educated in one of these decrepit areas that exist, then you go to those areas. Now, when there is widespread education, because we're funding community colleges, and we're funding colleges all around the country, and making it feasible and palatable for people to go to school here, that means that companies don't have that incentive to relocate all of the time. Sure, a lot of companies still will do this, but on the margins, you just make the calculus different for them. That they might want to stay in areas with lower rents, lower costs, etc., and they might actually choose, given the abundance of skilled labor in geographically disparate areas, to go to those places rather than to relocate to the areas which they typically do in the status quo. That means that you have more people in the low-income areas they talk about getting healthcare because they're now getting jobs, because jobs are available to them. The very fact of making education more abundant makes it easier to get healthcare in these instances. I will take opening if you have them.
Yeah, so you think that the idea that the only meaningful jobs that exist are the ones that require tertiary education are going to appeal to conservatives whose base are mostly like industrial workers or people who work in coal mines or the sort of thing where you don't need tertiary education?
Well, there's a chicken egg problem here, right? Like, we're not going to educate everybody who was once a coal miner, but there are a lot of people growing up in these areas who now either have to choose the choice of doing like a working class job or doing a job that actually they can get to with a tertiary education. When you guys say that like skills don't matter, that's just not true, right? There are jobs you are out of the running for if you do not have a college degree, and that's the sort of thing that we make more accessible. I just don't understand how it can be the case that a high school graduate has any chance of competing for a job that is service sector, or sorry, that is like, for instance, white collar at all, right? There are no white collar jobs you can get if you don't have a college education. That's ridiculous, right? Literally, stratification in this country is massively along education lines. It's not clear to me, right? There is a demographic we cannot educate, that's true. But there's also a new demographic that is welling up, that is literally those people's children that probably should be educated. So it's not clear to me why they're insulated from these political realities to that degree. Second thing that I want to talk about, though, is why they actually make people worse off. They say, why is the counterfactual better, right? We actually prefer what the Republicans were saying with high deductible payments and catastrophic care being supported to what they would do. What do? What they don't understand is that the way that the insurance industry is set up in this country means it's not competitive. They say there are multiple insurance companies, therefore there's competition, which ignores the fact that the monopolies that insurance companies have are geographic, i.e. there is one insurer per area and they don't compete with one another, right? Maybe you don't think that it's a complete monopoly, but there's this thing called oligopoly, which is pretty non-competitive. And here's the worst thing. When you have an individual mandate that requires people to buy insurance, you entrench this problem much more. Why? Because there's a guaranteed buyer of this insurance, which means that there's a moral hazard for insurers to jack up the price. They talk about better pricing, but better pricing is market pricing. And now, when the insurers are setting those prices, the negotiation makes it impossible, right? There's no cost control you can feasibly implement that would allow you to do these sorts of things. So you just jack up premium massively because insurers have that ability, and the government has to foot the bill when you have Obamacare in place. The second and final problem, though, is that No, sorry, yeah, no. Here, and then here's the final thing, right? Oh, let's see. Yeah, the final thing that I want to talk about, though, is why education is not going to get repealed, okay? Education is not going to get repealed because it's not making certain demographics better off and other ones substantially worse off in the way that their policy does, even if it were net better in their very best case. Why? Because education, even if some schools are liberal, is not uniformly liberal, right? What do we mean by this? That the Oklahoma local community college is not as liberal as the elite schools that they are talking about because not every school is uniformly liberal. The ones you see in the news are selected and cherry-picked in certain ways that not every single school is. And moreover, people make a value judgment, right? They say, yeah, I don't like the liberal climate in colleges, but I'd rather have a job. So people will still use the system, they'll still go into it, and they will use it. So ultimately, what have we told you? We've told you that it's not just the case that this policy they have is massively likely to be repealed because of the asymmetric effects that it has on these people, but also because it helps us with education. We're so proud to propose.
I thank member of government and now welcome member of opposition.
Is everyone ready? All right. In opening half, we saw a disagreement on whether the ACA was good or not. But I think that's not the relevant question. The question is whether the ACA is a kind of problem that necessitates government intervention in a way that college education does not. That's the first thing I'll be showing you. The second thing I'll be showing you is why, even if the ACA wasn't perfect, even if it is repealed in the future, the reasons why it's still good. Tejal alluded to this in the last minute of a speech, but I'll be expanding on this greatly in mine. Now, first of all, about education and healthcare, which is more essential for the government to provide. I think that this is the key comparative, right? Because you can't just prove that education and healthcare are equally necessary. It's about the nature of both problems and whether or not each of them necessitate a government solution. I think the problem is that colleges have incentives to give scholarships to students because they want to check the best and brightest. Furthermore, colleges might result in people having huge burdensome loans, but the fact that you have a college education also increases your ability to repay those loans. The difference is that with healthcare loans, you don't have an increased ability to pay healthcare loans just because you go for more surgeries. In fact, you have a decreased ability because you're spending on them, and because the more surgeries you go for also tends to mean the more surgeries you need to have in the future because of complications that arise from these sort of things. There are systemic problems with the healthcare system that require government intervention in a way that college education does not. Furthermore, we think everything Sinan told us about why the healthcare system is broken and is a monopoly is a reason that you should vote for side opposition, right? Because this very reason means that there's a necessary need for governments to intervene in the healthcare system. Why? Because we think hospital insurers have systemic reasons to harm those that are not insured. For the simple reason that insurers care about protecting people who can afford insurance. That is, they'll bargain with hospitals to say that, you have to reduce your price for my patients that are going to your hospital. Otherwise, I can make it such that people who buy insurance from my company simply go to another hospital. In that way, insurance make it disproportionately better, make the lives of people who have insurance disproportionately better than those who aren't. But those who aren't covered don't have such bargaining power. That is why the government needs to step in to bargain on their behalf and directly subsidize insurance for them. We think everything Sinan says about how they increase the moral hazard for insurance companies to increase the price of insurance is non-comparative, right? Because that also exists in your side. The difference in our side is that ACA at least subsidizes insurance where there is none on your side. So I think all of this shows why there being no long-term solution to healthcare in America is an objectively bad thing, because without government intervention, hospitals and insurance companies have got no incentive to help those who are uninsured, whereas colleges have an incentive to help those who can't afford a college education. But moving on to the second and most important part of the debate, debate how this affects politics. Now, Tejal said, like, you know, at the end of his speech, even if this is repealed in the future, it's still good because we can build upon the back of it, right? And we agree. We think that we depended upon this critical moment from 2008 to 2012 to put in place this healthcare reform, because we argue, and this is something that's unique from closing opposition, that you could not have done it at any time after Obama's first term because of the nature of politics in the US. To pass such sweeping healthcare reform, they needed a majority in the House, the Senate, and have the executive under Democratic control. And that's something that would not have happened, seeing as the tide was already turning to a Republican majority within Obama's first term. And that moment was in 2008 during Obama's first time. That's the only time such critical healthcare reform could have been passed. But why not later, right? Well, first of all, because we think that healthcare provision to this degree of government intervention is anathema to everything that Republicans want and everything that Republican voters will support, because they fear that this kind of government intervention is left-wing and necessarily leads to big government taking over their freedom and personal lives. That's why there will never be a Republican government that puts in place a similar policy of healthcare reform as Obama did. The reasons that OG gives why Obamacare is unpopular with Republicans are the specific reasons why it would never have happened in their world if not for the fact that Obama did it in 2008. Now, moving on, right? The comparative is this, that even if you buy everything that government tells you about education being more politically viable, the fact that education is more politically viable is a reason why Obama need not have used his majority at that time to put in place education reform, because it could have happened in the future under Trump. But healthcare reform is something that would not have happened in that situation. Before I move on to why Obamacare was still good in spite of its shortcomings, I'll take opening.
There existed will for healthcare reform based on both sides' analysis on your side. The bill was bad because of what it aims for and the singular focus on healthcare reform. Engage with the nuance that you can still have forms of healthcare reform while pushing this bill exclusively.
I think that throughout our bench, we provided you specific reasons why the problem with healthcare in America is with people with pre-existing conditions and people who are uninsured. Given that Obamacare specifically targets that problem, I don't know what general specific solution you're trying to suggest instead. Seeing as you haven't suggested it, I don't know what your comparative is. Now, why was it good in spite of the shortcomings, right? We think without Obamacare, first of all, as I already explained to you, there will have no other solution in the long term. But second of all, more importantly, it created certain frameworks for future Democrat House or future politicians who support the idea of a national healthcare insurance system to reinstate and strengthen Obamacare. Now, what kind of frameworks are we talking about, right? First of all, contracts of insurance companies are often very hard to negotiate. It takes years to get both sides to an agreement. Obamacare managed to do that, and then being able to do that means it makes it marginally easier for any politician in the future who wants to revive such kind of a healthcare reform to be able to do the same or even revive the exact same contract, albeit renegotiated in terms of future terms. Second of all, it put in place the technological infrastructure needed to run literally a nationwide website that sells insurance to people. Third of all, it trained specific people, hundreds of workers who worked on the ACA, to have the know-how of how to go about providing statewide insurance. These staffers and these people who know how to use technology are the specific people who you can tap on in the future if, for instance, statewide ACA wants to be implemented by states that are controlled by Democrats, or for instance, if the state decides to offer public sold insurance in the future. These are all possibilities that enable on our side of the house because Obamacare was instituted. So we don't need to defend Obamacare just in its perfect form. We can show how it being implemented enables future reform to happen that can't happen on their side. But moving on, right, we think third of all, the ACA also primed the population in a way to make them more receptive to the idea of a government-provided healthcare insurance, because people often receive cues from the kinds of things that politicians are telling them, and if you exist in a world where government intervention in healthcare is not even a possibility, it makes it much more unlikely that voters in the future would support it. But we prime the population to move slowly towards being more receptive to this idea, making it more likely that a future politician will be able to do that. We think that ultimately, people getting rid of the ACA is political suicide, meaning it's unlikely in either side of the house that people in the future will never want to will never want to provide national health care again. We think that in this event, it is a good thing that Obama can provide the frameworks for it. We're very proud to oppose.
I thank the opposition member and now welcome to the
Singapore's healthcare system is so lauded around the world is is in part because they do have a national catastrophic care system, but also because they incorporate substantial free market principles into the design of their system. The reason why we need to have more government involvement in education as opposed to healthcare is because the free market and market principles are effective at being able to reduce healthcare costs, and in the way that they are not effective at reducing education costs, because education is a public good. We believe that although there are rising premiums that occurred prior to Obamacare, that is largely because of the meddling of the government in causing them to have price increases that didn't require insurers to compete on price and didn't require them to negotiate with hospitals to have lower premiums precisely because they had guarantees of health insurance. What we're going to argue today, what we have brought you, is that while they have proven on-site opposition that they have given more insurance to people, that they have more health insurance to their side of the house, they don't give people better health. And that the only way that we can actually provide this is to have the government step back, and that we need to instead be inserting ourselves into education. 3 things I'm going to talk about in this speech. First off, the political ramifications. Second off, why they have horrible healthcare policies that they are advocating for. And third, why education is so important. First, political ramifications. All of opening half spends a lot of time on this, which is really curious given how they get nowhere close to the best version of this argument, because they always focus on repealability. But there's a lot more to politics than just whether or not you repeal Obamacare. What CNOT points out is that it's super easy in the case of healthcare to identify individual winners and losers. You have people who literally have to change their doctor, who wanted a doctor but couldn't keep it. Even if the policy is on net good, those people are super easy to put in front of a television camera and show them up on ads. Similarly, it's really easy to point to the fact that premiums increased and deductibles were increasing. People don't know whether the counterfactual was that it would have been lower, but they can still see that after Obamacare passed, this went up. So what we're arguing here is not just that we heard the limited argument about whether or not it will or will not get repealed, but rather that we see general backlash against progressive policies because of this invasion to healthcare. That the reason why Republicans won in 2010 was because of Obamacare. The reason why they took the Senate in 2014 was because of Obamacare. This is why the Obama could not get passage of any sort of climate change bill, for instance, why the Waxman bill just died in committee. It's because we saw the backlash against government intrusion into healthcare, which we think substantially outweighs insofar as they're at best, they're getting some tinkering with the healthcare system, but the cost was killing every other chance of a progressive reform. Okay, now let's talk about the issue of healthcare where we saw a lot of back and forth. The message that we left at the end of opening half was fairly predictable. What we heard from opening opposition is that costs are going to go down because you have more young people enrolled in these risk pools. What we heard from opening government is that that you get young people, and then we heard from opening government they're going to go up because you have more people who are risky but pre-existing conditions. Sinan provided you the sword to cut this Gordian knot, which is that he explained why it is that when you see these price increases, despite this just back and forth, was that when you have a government who guarantees that they are going to cover the cost of healthcare, what healthcare providers do is they increase the cost, and they report higher costs. It's super easy for them to do so, because the government can't just say, wait, that's not your cost. Why? Because the costs are things like their salary, and who knows how much a radiologist's salary is, it's whatever they're reporting. You know how we know this argument is fairly intuitive? Because opening opposition says this argument when they talk about education, except it didn't apply in that case, because you can just give block amounts. But you can't just give block amounts in terms of healthcare, because then they'll just say, but my salary is higher, and then no one wants to be able to take the political risk of saying that, oh, I wanted to be able to get healthcare, but the government wasn't going to be able to pay my doctor, and now I have some sort of terminal disease that I wasn't able to pay. What is so we think they massively push up the cost, which means that even if people got insurance to their side of the house, and they got insurance not because the government handed them surge, but just because the government forced them to get insurance, which is why so many of them left it when they no longer forced them when the individual mandate was repealed. But they still have higher costs, which means people go to the doctor less, they don't get these type of early screenings, which means their healthcare gets worse. What is the pushback we hear on this front? First off, they say, well, this is the only time we could have pushed for healthcare. It was needed in this political moment. This is silly. I mean, if the fact is the matter, in this current election, the Democrats, the majority of their ads are run on healthcare. This is always an issue in American politics. Moreover, that's not a reason to enact a bad policy. Just the only time to do it, then just let them vote to pass. Okay? Second, is they're saying that look, insurers can negotiate down the price of this insurance, and that's going to be good. The problem is that insurance companies don't negotiate down because they surprisingly have very little leverage. Why? One is because what we hear from the opening half, which is that hospitals are consolidating, which gives them disproportionate leverage over the insurance companies. But second off is because of the way that consumers respond to this insurance. which is that they just take it as a given because most of the costs are hidden for them because they're paid for by their employer. And they say that it is disastrous if I want to get care from this specialist in the specific form of like dermatological condition that I have, but that my network doesn't cover it. And they push for their network to cover it. And the fact is they end up paying for these expanded networks in terms of higher premium, but it's hidden for them because it's generally provided by their employer, which means that they end up getting it in lower salary, but because they don't see the cost, they end up reducing the sensitivity of insurance companies to how high the healthcare costs that are being demanded by the hospitals, which means that insurers can't lower it. Then we hear from closing this argument that's going to provide a bridge to a national healthcare system, but very little substantiation as to why a national healthcare system is good. We think a national healthcare system is horrendous, but the fact of the matter is that it arguably works in some other countries because they're willing to ration care. The British government, for instance, is willing to say to patients that no, we are not going to provide a drug that might be safe and effective because it's going to raise costs for everyone else for externalities. There's no political pressure to do that in the United States, which we've seen historically, such as in 2004. What's up?
We already gave you incentives as to why costs go down, but even if you're right and you have to pay higher deductibles, the comparative for a person who wasn't insured is either paying fully out of pocket or paying a deductible. That's always cheaper, and they're always going to get more preventative care and have better health.
The reason why there are two types of people who didn't have health insurance previously. One are young people who made a rational decision not to do this. The second are people who had pre-existing conditions in this case. In many cases, hospitals can't turn away someone who literally went to the emergency room. But second off, there actually was support for catastrophic care. This is literally something the Republicans have pushed for a very long time. They're just not pushing for it right now because it's much easier to criticize Democrats for their policy than to propose something meaningful and suffer the cost. Lastly, let's talk about the issue of education. We give you two reasons why this is much more important. First off is that the distributional argument that is to be spread around this type of skills, which means that everyone now has an opportunity to be able to compete in this global economy. And second off, you get skills beyond jobs such as cultural capital. The pushback we'll hear from this is mainly along the lines of, you don't need a college degree. Well, maybe you don't need an advanced degree like from the universities that I guess are represented in this round, which is sort of awkward here. But like, you still be pre-professional, like associate's degree are super useful for a wide variety of jobs. But this is the also important point, which is that it creates public goods beyond just those that are seen to internalize the individual. It gives people, for instance, the cultural capital to be able to navigate healthcare spaces, so that when someone tries to deny them the healthcare, they know to say, can I talk to your manager and actually navigate the systems? This makes the overall system much more accessible to everyone and creates a public good that extends beyond the individuals, which is why the government specifically needs to intervene in the education space and not healthcare.
CG's extension is actually insane. They say it is bad for people to go to hospitals because then hospitals can raise prices. But the bad outcome from your argument is literally the thing that you defend, which is that prices don't go up because there is not enough demand for healthcare. Why is there not enough demand for healthcare? Because people cannot afford it. The consequence of their argument is, the bad consequence of their argument is the thing that they defend, therefore they will lose this round. I want to talk about a few issues. Firstly, about politics and political effects, then about a sort of big comparative in terms of the effects on the healthcare market versus the educational market. So let's begin with politics. Our stance is basically the following. Obama needed to use that specific time in order to pass Obamacare, or else there would have been no substantial change for healthcare in the long run. Why does this matter? Because the status quo of healthcare before Obamacare was actually absolutely terrible in ways that government has been absolutely not engaging with at all. So you had millions of people completely uninsured. You had much less people with Medicaid. If you had things like HIV or diabetes or cancer or some other pre-existing condition and you weren't very, very rich, it was extremely difficult for you to get any semblance of insurance at all. That is the world that they need to defend when they make their trade-off. what did Obamacare change? So there's a few reasons given that I think stand in this debate about why Obamacare is comparatively good. But the most important reason we give is because it creates the frameworks for the types of long-run healthcare changes that can actually make things better and actually alleviate the sort of meager problems that they talk about. What are these solutions? Things like Obamacare creates precedents for contracts with insurers. It creates the know-how in terms of how to run a healthcare system. It does things like create the possibility for a public insurance alternative towards the long run. The only response that we hear from the AO is, this is terrible because in Britain they have to limit how much they give to certain people, and in the US this would simply not fly. The problem is that this specific alternative, which is single payer, is not the alternative that we were saying could be built on Obamacare in the first place. Rather, we were saying, in the long run, Obamacare's problems are likely to be solved in a way that is appropriate to the US context. So this specific response about why single payer is bad just doesn't apply because this isn't the solution that we were talking about anyways. So the conclusion from all of this is the following. Whatever problems existed with healthcare, which were very significant, can only be solved in a world where a first step is taken. Obamacare is that first step, and we're proud to defend it. And if it had to be traded off with other things, we think that the fact that healthcare was in such a bad situation makes that trade-off legitimate. Insofar as they haven't engaged with why healthcare was super bad, they cannot just say, that's not true, but sorry, we give you no reasons why. Okay, the one remaining argument in terms of politics that they give is, look, short-term premium increases is what made Trump win the election. We think this is untrue. Firstly, the spike in premiums was literally happened 2 years before the election, right? People had already gotten used to this. The second thing we say is that Obamacare generally ended benefiting a lot of people. No thanks. So what about the millions of people who got insurance? Why doesn't their political capital count? So you might think, look, they've provided some reasons, they've provided some reasons, this argument is a wash. Okay, this argument is a wash, it came from government. Since they haven't engaged with a comparative about why Obamacare did benefit some people, they can't just say this is what got Trump elected. Okay, then they say, you can appeal to people who lost their doctors. We say that here's a very important point. So many people had pre-existing conditions in the United States that almost anyone was quite likely to know another human being who also had a pre-existing condition. That is an extremely strong emotional and empathetic appeal about a specific good that Obamacare created that makes it unlikely that it is so bad politically. So all that flows to us. No. Let's talk about healthcare markets. They say, look, this government incentive is bad because a lot of people flood into the system, right? They say this means hospitals can raise prices. Here's the thing. It's unclear why the healthcare system doesn't have basic market incentives that can actually reduce costs. So, okay, more people enter the healthcare system. What this means is that A, other players have more of an incentive to enter the healthcare market, therefore increasing supply, therefore reducing prices. Or B, alternative hospitals and suppliers simply have an incentive to lower prices and make things balance out in general. But in any case, they haven't engaged with a comparative, which is, this is state-subsidized insurance for a lot of people. So why exactly is it that the increase in costs isn't going to be met by an increase in subsidies? The problem that they mention is that, look, insurance companies can't negotiate prices down with hospitals. Firstly, prove to me why hospitals are bigger than big insurance companies. Secondly, we say that insurance companies have large client bases that hospitals do care about because those are literally their customers. The next thing they say is, look, employers pay for insurance, not individual people, so there's no incentive for insurers to lower their costs. We say precisely, companies want to pay lower healthcare costs, so they are the ones who, when they offer healthcare systems to their employees, they are the ones who force insurance companies to lower their prices. Yeah.
The reason why insurance companies don't have an incentive to negotiate strongly with hospitals is they don't suffer the cost of having to pay higher when they jack up premiums, because the costs are largely hidden from consumers that get paid out to Medicare and Medicaid, or they get it paid out to their employees.
Okay, it's just a lie that you don't know what your premium is. And we say, when you tell us that big companies pay for insurance for their employees, those big companies have the incentive to hire really smart analysts that actually look at all the hidden information and actually do drive prices down. Okay, then they talk about education. So what are the reasons that they give you about why education needs to be provided by the state? They say education is a public good. Literally, definitionally, it is not. It is alienable and it is excludable. They say, look, you need to fund colleges throughout the country to create less geographic inequality. We say that the colleges which produce people who have asymmetrically good productivity at another order of magnitude are still going to be the same colleges just because of reputation, capital, and so on. Here's a very important point that Colin made that they just completely missed. This is a point. When you go to college and you take out a student loan, that college experience gives you an increased capacity to pay for that loan. On the other side, there's A, little reason for banks to give you loans for healthcare, and B, you're not like particularly more productive than before you got sick, so it's unclear why you can pay those loans. This is a clear reason why private markets are just more able to pay for education. And if it just so happens that one specific school didn't provide the increase in productivity for a person to be able to pay that loan, then maybe it would have been preferable for that person not to have that specific education in the first place. So what this means is that there is a clear reason why health markets necessitate government intervention in a way that education systems clearly do not. So because those reasons are given exclusively by closing opposition, and because we provide the reasons why we lead to positive long-term changes that are necessary, we are extremely proud to oppose this motion.